Well, good morning and welcome to CityLine. It is great to be in your home this Thursday morning. It is March 12th, and it was a little brisk this morning when I came in, some ice on the windshield, but hopefully since daylight savings time has arrived, it feels like that spring is just around the corner, and of course the cherry blossoms agree as well. We have a great hour ahead of us. Later on, we'll be talking with Associated Ministries. Mike Yoder is here to talk about what we can do right now to protect those who are less vulnerable. And then with me also, I have the Humane Society. Victoria is here, and usually we get to see Victoria in the corner with one of our precious four-legged animals that we call the pet of the week. Well, Victoria is going to actually sit on the comfy couch and bring the pet of the week with her. And we're going to talk about the Humane Society and all of the beautiful pets, some of their upcoming events, so we get to spend a little extra time with her, and we are jazzed about that as well. With me right now, I have somebody on the comfy couch who is probably one of the most popular people in Tacoma, because this person, number one, is quite fabulous, but this person also works for the Tacoma-Pierce County Health Department. So please join me in welcoming Kim Steele-Peter. What a great name.
Thank you.
You are an investigation group supervisor for our Tacoma-Pierce County Health Department. Welcome.
Thank you very much for having me.
Thank you for being here. Obviously, you are here because we are in the midst of talking about the coronavirus. So before we talk about where we are with this virus, we have a video from Dr. Chen. He is the Director of Health for Tacoma-Pierce County Health Department. So we're going to roll the video, and then you and I are going to chat.
Perfect.
Here we go.
We know that this virus is about as infectious as the regular flu virus. We know that 80% of people are not going to have severe illness. We're seeing that the younger people and the kids are not being severely affected by this. We want people to wash their hands, cover their cough, stay home when they're sick, try not to be touching their eyes and nose and mouth. What would you do if you had the cold or the flu? Stay home, get a lot of rest and sleep, drink lots of fluids. If they're running a fever, take Tylenol or whatever to bring the temperature down. If they're coughing, use cough syrup. And then if they're getting sicker, of course they should reach out to their medical provider. And if it fits, do they need to be tested? And their medical provider can arrange for that to be done. If we see cases starting to pop up at the school, at that place of work, at this community center, in many different places in the community, that could be an indication that we're having a lot of spread. And if we were at that point, then we would make certain decisions about, do we close public events? Do we cancel schools? We do not want people, locking themselves up at home just because they're scared about this virus.
What a great video, and I was telling you I've met Dr. Chen, and he is just lovely.
He is.
So, Ms. Kim, let's get into it. This is a busy time for healthcare providers.
Yes.
First, let's clarify some things. Is it coronavirus or is it COVID-19?
Well, both are correct.
Okay.
It is the coronavirus disease, and that is shortened into COVID. CO for corona, VI for virus, and D for disease. 19 refers to the year that it was identified, 2019.
Okay, so
simple as that.
It's young in its existence.
It is.
It is.
Absolutely.
So why does the virus and then the disease have different names?
Absolutely. So viruses are named by the International Committee on Taxonomy of Viruses.
Same people who name tornadoes and things like that.
It feels like that sometimes, doesn't it?
Check it off.
Absolutely. And they name it based on the genetic makeup of the virus and which other viruses is it genetically related to.
Oh, okay.
So this particular virus is severe acute respiratory syndrome coronavirus 2, which is a mouthful.
Yeah, it is.
So that gets shortened to SARS-CoV-2. That's the name of the virus. Easy. Okay.
Easy. That's the only easy thing about this is the pronunciation.
Absolutely. So viruses, that's how viruses are named. Diseases are named by the World Health Organization,
Oh, cool.
WHO. Absolutely. And it's fairly common for viruses and diseases to have different names. HIV is the virus that causes the disease AIDS. Rubiola is the virus that causes the disease measles.
Yep.
SARS-CoV-2 is the virus that causes the disease COVID-19 or coronavirus.
God, I'm just going to take you home with me because you explain things so simply.
Thank you.
So let's talk about what are the symptoms, and we want to put out there that this conversation that we are having Thursday morning, March 12th, is this conversation.
Yes.
It's just like every day is a new day. Every day is a new day and a new conversation with this virus. So for today, what are the symptoms?
Symptoms primarily are going to be fever, cough, shortness of breath. As you saw in that video that Dr. Chen illustrated very nicely, that 80% of people with this disease will have very mild symptoms. They may only have 1 or 2 of the symptoms. Those symptoms may go away. They may start feeling better really quickly. So just because you have the virus doesn't mean that you're going to get really sick or that you have to be hospitalized.
There we go. Oh, beautifully said. I mean, I'm sitting here right now and I have a little bit of a sore throat.
Yeah.
I have a little bit of a stuffed up nose. But these are normal things for me first thing in the morning.
Yeah.
I always have a stuffed up nose, and I've been talking a lot, and I know my throat is sore. It always happens to me. So I'm not going to hit the panic button, but I am going to check in with myself and say, how many days have I had this? And I have no fever. So therefore, I feel I'm okay.
Correct. Absolutely.
Okay, that's good. So what should you do? What should I do? And we're going to use me as the example.
Exactly.
If I start to experience more of these symptoms, like for instance, a fever.
Right. So what we're telling people is that if you are having some of these symptoms and you fall into a high risk group, and that would be somebody who has a weakened immune system, maybe due to a disease that they have or medication. Maybe they're on chemotherapy. Something that is making them more susceptible, that would put them in a higher concern. If you are over the age of 60, right, that is another group that we're going to be a little more concerned. I know, steaming right, absolutely, right, straightforward. Absolutely, and if you're pregnant.
No.
Right, I know. You and I are maybe a little bit past that.
You.
Yes, absolutely. So those are the groups. If you're having those symptoms and you are in one of those groups where you could be more susceptible to getting the virus, you would want to talk to your provider. And see if you should be tested.
Okay.
Okay.
Excellent.
Absolutely.
So we've talked about, we kind of covered who should get tested. Those with weakened immune systems, those who are in that older protected class. Anybody else we're missing that that should get tested? People who are on the front line of things, people who work in fast food, should they worry? Should they get tested right away?
Again, I think that's going to be a discussion between yourself and then your provider.
All right.
Is there something else that has put you at risk for coming in contact with the coronavirus disease? And again, we have people that are like, I don't know how I got this disease. I haven't been around anyone. And it may be that they're just not aware that somebody that they came in close contact with had the disease, or it could be something else that we just don't know yet.
Exactly. Speaking of that, things that we don't know, we have a graphic we're going to show here, Miss Kim. Let's ask the question and then let's answer it. How is it spread?
Absolutely. So it is spread through droplets. If you're coughing, you're sneezing, you're producing droplets that are going to go out. They can go out up to 6 feet in front of you. And if you're coming in and you are breathing in those droplets, that virus is contained in the droplets, and that is a potential way for you to become infected. We know also that those droplets are going to land on a surface. And so it is possible that if you were to touch a surface and then touch your mouth, your nose, your eyes, that the virus could get introduced into your body that way as well. Okay. Also, there is the potential for people to transmit the virus before they're even developing symptoms. And that's something that we will have to learn more about as this disease progresses.
So, a couple questions I want to kind of put to bed here. We're going to play kind of a true or false game.
Okay.
Can you get the virus from used clothing?
I would say no.
Can you get it from pets?
That I don't know. I can't answer that.
So that goes in the
question.
neutral category.
Yeah.
We don't know as of this conversation.
Absolutely.
Okay. So, and can you get it from eating in restaurants? I know, I'm really putting you on the spot here.
I love this.
I love you.
I love this. So I'm also going to say that at this point, because that is, I love your question. It's a nice broad question, and there are so many ways to unpack that.
Yeah.
That I don't feel I could do it justice, because when you're in a restaurant,
Right.
you can be sitting next to somebody who may be sick.
Exactly.
You know, in theory, right. I mean,
We don't know.
we don't know. The utensils are being washed.
Right.
I'm not concerned about that.
Right.
Did somebody sneeze in my food? Well, of course, they're they're food workers. They're not going to do that. We have protections in place for that. But so without answering your question directly,
You've answered it.
Thank you very much.
Because, as we sit here and we are in our beautiful city of Tacoma, none of us are exempt from what we're reading in the media.
Right.
The News Tribune, social media, TV, which I don't watch, but radio, all of that.
Right.
And you don't watch TV either.
know.
But we are, in addition to taking care of ourselves
Yes.
and those around us, we are also concerned about local businesses, and that's the reason why I asked that question. Because, there are. I'm in Stadium Thriftway every single day buying
Right.
baked chicken.
Yes.
I'm stubborn. I'm not going to change that. And so if I change that, if I start changing those things and not keep my eye on the ball of participating in a very healthy, cautious way, I'm limiting myself to living life. And there's a fine line, isn't there?
There is. Absolutely. Yes. I agree with you completely that we want people to live their lives. I mean, there are some recommendations, some guidances that are coming out. And so I would say stay up to date.
Yes.
Our website
There we go.
has lots of information. We are an up-to-date, reliable source of information. We are working around the clock.
7 days a week, is that correct?
We have staff at the health department. We're not open 7 days a week, but we have staff at the health department 7 days a week. Wow. I'm one of them.
Wow.
That we are working behind the scenes to make sure that we are doing everything possible to get the information out that the public and our community partners needs, and that we are doing these investigations. When I say investigations, following up with people who have been diagnosed, answering calls from providers, from the public, doing everything that we can that public health normally does.
Does, yes.
To keep our community safe.
Yeah, you do such a great job. And the test of that is in times like this.
Yes.
When we start saying, what does the health department have to say? They're always there, they're reliable. You know, they're like electricity, they don't ever stop.
Exactly.
If I have been around somebody that has been diagnosed with the virus, and sometimes you don't know. You don't know until you hear, wow, this workplace, somebody showed up. Now they're sick 14 days later, but they made the rounds of where I made the rounds. What should I do?
So if you've been in close contact with someone who has COVID-19, and by close contact, we're saying less than 6 feet.
Like you and I.
Yes, exactly, for a duration of time.
Yeah.
Absolutely. So what you're going to want to do is monitor yourself. You were talking earlier about, I got a little sore throat, this. You're going to keep doing that. Am I developing a fever, sore throat, shortness of breath, cough? And you're going to do that from the 14 days after your last contact with someone.
Excellent, Kim. Thank you.
Yes. So if we found out today that I was diagnosed, you are going to want to, for the next 14 days, even if you find out a week from now, you're going to be like, okay, I can take 5 days off, but for the next 8 whatever days, I'm going to monitor myself.
Right.
The other thing is that if you truly have been in close contact with someone who has COVID-19, you're going to need to stay home from work and from school and avoid public places for those 14 days. Again, because we're trying to mitigate, to reduce the chance that you might inadvertently expose or infect other people. Because again, I said, there's that possibility that people could transmit a few days before they develop symptoms.
Absolutely.
Yeah.
There are so many sources and so much information about this right now, and rightly so.
Right.
Where can we turn to, we being the audience that we are talking to right now, for the latest local information? What's the best source?
Absolutely. Again, our website, we are working so hard. We have a whole communications team that is devoted to making sure that we're on top and that of the information that is being presented elsewhere. And so our website, tpchd.org, is where you're going to go. Coronavirus is on our homepage, and that's where you're going to find information about, we have frequently asked questions, what to do if I'm exposed, what to do if I have symptoms, who should be tested. All of those questions we have answered on our website.
This last minute, let's talk about employers and what kind of frame of mind they need to take with their at-work family during this time.
Certainly support any employee who is sick. This time of year, yes, we have COVID-19 going on, but we also have cold and flu. And anytime that you have an employee who is sick, who is not feeling well, they need to feel comfortable that they can stay at home and take that sick leave so that they're not exposing or infecting their coworkers, their families, that coworker family.
There we go.
Okay.
You are such a gift. I need to have you back on in a month. Can we do that? Can we have a little date check-in? Because I sense we're going to still either be in the midst of this or we'll be cleaning it up, but we still want to check in.
Absolutely. I would love to. Amanda, you were wonderful to talk to. Thank you.
Thank you for taking care of us so beautifully. And you take care of yourself.
Thank you very much.
You're welcome. When we come back, we're going to have Victoria and Goliath from the Humane Society. You don't want to miss that. We'll be right back.